How many speech sounds in tree? T, r, e. 3 sounds. But what if I couldn't pronounce t and I couldn't pronounce r? I might call it a D. Have you ever heard a child call a tree a D? I've got some flowers I'm going to plant, some beautiful yellow flowers. Have you heard someone you're trying to help with clear speech say lello? They can't seem to get the first part of the word. Or maybe at lunchtime, do you ask them if they want a fork, do they want a spoon, or do they want a knife? Boon, please. And you're like, boon? Why did they say boon? I can't hear the s. And why is the p like a b? For fork, they might call it a bort. They've changed the f to b, and they've changed the k on the end to t. Bort. What would you do if you were trying to help someone with their speech? Could be a preschooler, a school-aged child, or even an older person or adult. Well, you'd probably think about referring to a speech pathologist, but sometimes it's hard to get in. Sometimes there's waiting lists, or there are other reasons why you just can't get into speech pathology. Well, of course, I'm going to recommend speech pathology, but I'm sure you're going to try some things too while you're waiting or while you're thinking about your options. And for that reason, I've written a short course on helping people with articulation skills. It runs for 12 weeks or 12 topics, and you can actually study it fully online. Now, if you've got questions about the cost of this course, the timing, and the content, then you might like to come and join one of my free online webinars all about the Articulation Short Course. You can come on and have a listen. You can have it on in the background. You can ask questions, and I'm going to go through step by step the details that I'll be covering in the Articulation Short Course for people working in early childhood, in schools, in any kind of disability field. It might be you're a community worker or an early intervention worker. It's also suitable for some parents or grandparents or family members who are thinking they would like to learn some skills and some knowledge and a few strategies or quick tips to help their child at home. And it could be you're helping them in between speech pathology sessions. So you're still seeing the speech pathologist, but it's giving you extra confidence to do the follow-up at home. Or it could be that you're having some skills and ideas to use while you're on a waiting list for speech pathology. So the bottom line is you're all welcome to the webinar, and we all need clear speech, don't we? Because every day we're wanting to say things like, with my dog, Rupert, I want to say his name, Rupert. And when I get to school, if I'm a child, I want to be able to say my own name, and I want to be understood. And if I want to tell someone that on the weekend I planted some flowers, I don't want to get mixed up if I call them bowers and they're not sure what bowers are. So here's my dog, Tim. If you would like some tips and tricks on how to help a child to say Tim with a soft t and a on the end, or to tell us that this dog is black with a b and white with a t on the end, then why not jump on the webinar, find out a bit more about the course, and have a chance to ask some questions. What do you say, Tim? Should we go and practice our speech sounds? Or maybe you want to practice your woofing.